Recently, I went to the ER for kidney stones, and while I was there, they discovered an aneurysm that needed repair. I just want to talk a little bit about that experience from the hospital billing side. If you'll hang in with me, we'll talk about that in just a minute. My name's Chris. I am a registered nurse and an ordained pastor, and I post videos about healthcare topics and spiritual topics. I'd love for you to subscribe to the channel, follow, all that stuff as we talk about things that I think touch upon where many of us are in our lives. After I turned about 50 years old, I experienced more health-related issues. I found that as my children got older and we lost all those tax credits, we went through a period where things were pretty good. The kids were out of the home. We didn't have a lot of those expenses yet. I had a stroke in 2019. And since that stroke, a lot of things have happened, heart surgeries and all sorts of things that are related to a birth defect that I had that I didn't know about. And since then, I've had a number of health issues. It is what it is. But I did find some things that are very interesting coming out of my experience in hospital billing. And I want to talk about that and also put it kind of in the context about what's going on with these hospitals. I'm not mad at the hospitals. I'm frustrated, but not mad at them because I understand, having worked in the healthcare field and worked in a hospital, actually one of the hospitals that I'm having billing issues with, I understand what's going on. But I also, it's something I think we need to be talking about as a society, because I'm not the only person that's being affected by these things that have health issues. And what's happening is those of us who have insurance, and I've been responsible and saving money, having my employer take out money every month for a health savings account. I'm not wealthy. In fact, my wife and I often struggle to, right now, this season of our life, to get by month, and the medical bills are a huge part of that struggle. And these bills just seem to keep coming. Anytime something happens for me or for my wife, we find that the insurance often doesn't want to pay. They'll say, well, we'll cover this, but we'll not cover that. And so some of the stuff they say they're not going to cover doesn't go towards your deductible and all those things. It just gets very complicated, and then you find yourself on the phone trying to argue every little thing, and it's just a whole frustrating mess. One of the things that was interesting for me is I got a call a while ago. I had gone to the ER. Turns out I had kidney stones, and they did a CT. And out of that CT scan, they not only saw a kidney stone, but they also saw that I had an aneurysm. And that aneurysm was large enough to need repair, so I was referred to a surgeon. Now, because of the area that I live in, and because of the Affordable Care Act, many hospitals are reducing services, are not offering services, don't have specialists. So the nearest surgeon that could do the surgery to repair that aneurysm, to put a stent in, was 110 miles away from me. And so I didn't really have a whole lot of choice. I had to use that hospital because that was the closest hospital that could do the surgery that I needed done. So anyway, so I'm at the ER. I have this kidney stone. I'm there 3, maybe 4 hours. Got medication. I prefer Toradol when I have kidney stones because that medicine it's not narcotic, and it seems to work much better for me than getting loaded up with things like Dilaudid and all those other medicines. They're just not, to me, they're not effective. So there wasn't a lot. I had some Toradol. I think at the very end, because it was kind of painful, just to take the edge off. I was feeling better. I got maybe a small dose of morphine, but that's not something that I regularly do. I just wanted to get home, and we heard about the aneurysm, and it was interesting hearing about the aneurysm to realize that aneurysm had been on prior diagnostics when I was in for, I think it was my heart surgery. I can't remember exactly what I was in for, but they saw the beginning of that aneurysm and nobody told me. So I didn't realize, because nobody said anything, that I had an aneurysm on a prior diagnostic, because this is the way they're trying to move you in and move you out, and maybe what you're in for, that wasn't what I was in for at the time, so that nobody bothered to mention it to me, so I didn't know that I had that issue going on. So meanwhile, that aneurysm is growing and growing to the point that it needs intervention. So I'm in for my kidney stone, and then find out that I have this aneurysm that needs intervention. So anyway, I get this ER bill, or I get this call. I don't get a bill. That's the whole point. No bill, nothing. And then I get a courtesy call from the hospital saying I owe them like almost $1,800. And it was a courtesy call before collections. And I said, well, aren't you going to send me a bill? An itemized bill that tells me what I owe, what insurance didn't pay. Why am I paying this $1,800? What's going on here? I need to see a bill. I need to see what you've billed to insurance. I need to see what you haven't billed to insurance. And I need to know what the itemized bill was. And I was taken back because I had just been on that charting program that, you know, when you go on called My Chart or whatever, different companies, different hospitals call them different things. And I just paid the bill, and there was not this huge bill on my chart. So I'm sitting there going, why is this hospital, and it was a hospital number, why are they calling me trying to collect on a bill that they haven't even put on my chart, and threaten me about this? And so I said, look, I can't confirm a bill, and I would encourage anybody to do that. It's not fair for you to affirm anything from a hospital if you have not got an itemized bill. They need to send you a bill so you know exactly what you're paying for. You need to know whether that really is a legitimate debt or not, or it's something that needs to be disputed. So I said, I can't even confirm that this is my debt. You're calling me about this almost $1,800 and say, I owe this, and I just haven't seen anything. So I went and I looked on my insurance, and I was shocked because it's 4-hour stay in the ER is getting billed to my insurance at over $11,000. Over $11,000 for a 3 or 4 hour stay in the ER, with the only significant diagnostic being that CT scan. I don't think, if I remember, I don't even think they did anything else. And so here's this bill, and then I'm looking at my EOB. Is there somewhere where they say that I don't cover? And no, well, what I saw is I owe several $100s, which I had already paid. So where are they coming up with this $1,800 that I owe? And why aren't they sending a bill? To me, it was just a very questionable practice of the hospital to be calling people and trying to pressure them into paying when they've not sent a bill. And it gets better, because I had to go to this second hospital to get the aneurysm repair done. And this hospital prides itself on being a religious Christian hospital, following Christian ethics and Christian principles and all that. And so it was interesting. It's been interesting to me. So I go there, and they say, this is what your out-of-pocket cost is for this procedure. This is what's going to happen. You're going to stay a night in the hospital for observation, and for the surgical procedure, the night in the hospital for observation, all of that, you're going to owe about $3,000 out of pocket. So I said, oh, okay. That's understandable. I have my health savings account. I've been saving up for several years, so I had a little bit of a balance. And so I said, okay, I'll go ahead and pay this. And I thought, okay, so now I'm going to pay this and that's going to be that. But in the last couple billing cycles, I'm getting a lot of additional bills. It's almost like this hospital has said, hey, he's got a health savings card. Hit him up for as much as you can. Start adding charges. And those charges now are over $1,000. So what I thought out of pocket was just going to be $3,000 is now well over $4,000. And who knows when it's going to stop, because they seem with each billing statement seem to keep adding these additional charges that are coming out from nowhere. So I'm wanting, like, show me a bill. Show me how, justify these charges for me. I think what was interesting also is after I left surgery, I needed to do my overnight observation. I needed to do it in a medical surgical bed. That's what I had was not such a complicated procedure. The biggest risk was going to be bleeding. And so I was expecting that's where I'd be going. But instead, apparently there wasn't a regular medical surgical bed available. So I was placed as not as an ICU patient, but I was placed in an ICU bed, even though I was not an ICU patient. And I think part of what's happening is that billing, the insurance is saying, look, he was never an ICU patient. Why should we have to pay for ICU care for somebody that was not an ICU patient? He was ambulatory, he was eating, he was drinking, he was just there for observation for the night because of the bleeding risk from that stent placement. So what's going on there? So here I am getting additional bills and additional bills, not because of any choice that I made, but because the hospital was not, I don't think, I'm trying to get to the bottom of this, but I don't think they were efficient in managing the hospital beds. I've got a patient coming in for surgery and decide to keep him for the night for observation and did not do good planning for what kind of bed for his acuity level that he needed. That's an issue. So should I pay for that? Or is that part of the hospital's responsibility? And I think a lot of hospitals now are trying to find any way to get additional charges from their insured patients. And insurance companies aren't going to buy into those. And a lot of times, those charges that aren't necessary or justified for the procedure being done is getting passed on to the patient, and the patients are getting hit with these bills. Thankfully, I have a health savings account. The balance is a lot smaller than it was when I started, but thankfully I have that account that I could be able to pay for that. Because if not, if I was having to make monthly payments, it would just add to the crushing debt of medical debt that my wife and I have. At different points in the last couple of years, we've been paying close to $1,000 a month in medical bills, and that's crushing for our family. And that is kind of where things are at. And that causes a lot of frustration and a lot of anger. And people are just tired of it. But I don't blame the hospitals, like I said. I don't blame them. In our region, the vast majority of patients and procedures and everything in the hospital is billed to Medicare or Medicaid. And those reimbursement rates don't come anywhere near covering the cost of the care provided. And the thing is, Medicare and Medicaid, they don't have the resources. We're looking at Medicare being insolvent in 8 years. They don't have the resources to increase reimbursement rates, and they're not covering the cost of their patients in the hospital. And so on top of that, especially in our area, there are a lot of uninsured. Now, I know that you're saying, but the Affordable Care Act took all of that. There's nobody without insurance, Chris. But you're wrong. There are a lot of people without insurance that are going to the hospital, they're going to emergency rooms that are not insured through the Affordable Care Act. Most of those people, in my experience working in the hospital, are drug addicts, are people who are mentally ill, mentally unstable, are people who are homeless and move from place to place to place, migrants. People who are basically illiterate and not even tuned in and understand what's available to them through the Affordable Care Act. And so you've got this whole group of people, especially in rural hospitals. What they're doing is they're going to these hospitals for treatment, to the ER when they need it, and there's a huge cost to get them stabilized. And there's a huge cost when some of them need to stay in an ICU or stay in a hospital bed because they're not stable for sometimes days on end. And those huge costs get absorbed by the hospital. So not only is Medicare and Medicaid not adequately reimbursing hospitals, but the uninsured are adding an additional burden of costs. And so what does that do? That leaves the insured, the people with insurance, people who are working, people who are saving, people who are paying their taxes and all of that are trying to survive and be the ones that are funding all these services, like Medicare and Medicaid, through their taxes. And so what I've been observing, and I've been hearing more and more people talking about this, is that the hospitals are going after every penny they can with these insurance companies to make up the deficit and the money that they're losing in other areas. And they're going to go after every penny that they can. And they're going to essentially overcharge. And I'm fearful, and I think this is where things can go wrong, is that financial pressure that hospitals face can lead to unethical practices. At one point, my wife and I got a bill for my heart surgery. And when I went into heart surgery, I'm familiar, nursing training. Actually, where I had my surgery was in the system where I had done a lot of my medical school, or my nursing school clinicals. So, I was kind of familiar with the setup and everything, but we saw some of the itemized bills, like charging $350 for crushed ice for my surgery. You see all these little bills, and you see what the hospital is trying to charge out compared to what the value, what the cost for the hospital is. Well, what they're trying to do is they're trying to make up for losses in other places by way overcharging. And so it leaves people like me footing the bill. And I think part of our problem in healthcare is that nobody is really screaming loud enough, talking about this as much. It's not hitting the public. Now, there are people talking about it or warning about it, and you can look up, you go on your friend Google, and you could Google all sorts of articles that are talking about this issue and why it's so important to deal with. The problem is that it's not sinking into the public consciousness. People aren't realizing what a dysfunctional system our healthcare system is, and realize, and I want to do some more videos, I think, on the Affordable Care Act, because there are some really good things that came out of the Affordable Care Act, and it turned out to be a net positive for suburban and urban hospitals. For small towns like where I live, small towns and rural hospitals, the ACA is devastating. For small town environments, it is crushing. It is killing healthcare. It's taking healthcare away from the, depending on the survey, 45 to 60 million rural Americans are losing their healthcare because of the Affordable Care Act. And while there have been some great gains and some real benefits in some areas, other areas are simply losing out. And so we want to I think have more of a conversation. And one of the things that's troubling to me is when I hear, well, we're going to repeal and replace Obamacare. That makes a great political slogan. But what does that mean? Do you even know what the issues are? And I think a lot of the people that are most rambling on about Obamacare, the Affordable Care Act, they have no idea what the issues are. They don't even know what would make things better. They don't even know what the challenges are. Because probably the biggest challenge that we have is we have a shortage of healthcare providers compared to our growing population, our aging boomers, and we are losing doctors. We're getting fewer and fewer doctors, and it's becoming more and more of a crisis where people don't have access to health care. They have all the insurance in the world, but no access to quality care. Rural hospitals, small town hospitals are closing down at an alarming rate. And people that live in more rural, small town, small city areas often will have to drive 50, 60, 100 miles to get quality care because there's nothing in their community, because the community hospital, the community medical practices aren't staying open they're just closing down. Doctors are retiring and leaving, and those hospitals can't even get providers to replace them. There's a lot of issues that are going on. So when we look at our billing, like I look at the billing that I'm getting, it's just a reminder to me how broken our system is and that there's no easy fix. And I would encourage all of you that are watching this video to start spreading this conversation, start talking about it, talk in the comments, engage, because we need to get this conversation out in the public, especially in a presidential election year coming up in 2024. We need our politicians to go on record and make some commitments about understanding the problem and what they plan to do about it. We need to be yelling really loud because they won't listen unless we really make it uncomfortable for them and force them to deal with the issue and not just do whatever the pharmaceutical association or the large hospital associations with all the big lobbying bucks tell them to do. We need them to think about what's best for all Americans and not just what's best for the big corporate healthcare entities. That's part of the problem, is our Congress and our representatives are doing what's best for the big corporate entities without thinking about how that really impacts all of us. And it's leaving a healthcare system that is an absolute mess. So I'm getting off my soapbox with my little rant there, but I do want to get this video out and try to see if we can get some people engaged in talking about it. Talk about it in the comments. Share this video of somebody who might find that this is helpful content, because I really do want to get conversation going, because I think now is a time, if you're affected by this, to be talking about it and begin to get this in the public view. So thanks so much for tuning in. Again, this is Pastor Chris, RN. This is Chris. I'm a registered nurse and ordained pastor. I thank you for watching, and I'll see you next time I post.